Over 1,200 healthcare workers, including clinical staff such as nurses and doctors, are not on duty at hospitals in the Western Cape. While there are very low numbers of severe illness and hospital admissions, the majority are either in isolation or in quarantine. From major hospitals like Tygerberg to small clinics scattered across the province are affected.
In the bigger places like Tygerberg, people are getting a combination of agency staff. They're getting a redirection of their own activities and redirect people in accordance to actually managing the service. Our appeal is to anybody getting service anywhere. Wherever you're going to come, you potentially are going to wait because our staff are not on duty because they have to isolate and quarantine. We're asking for patience wherever you find yourself in relation to those specific things.
Kluter warns that further scientific study is needed, but early signs are that Omicron is very different to other strains. Over 1,000 people were admitted to hospital in the province last week and were predominantly between the ages of 26 to 35 years. However, early evidence shows a much lower hospital admission rate than in previous waves and no increase in the number of daily deaths.
The proportion of cases with severe disease to date has been lower. It's most likely, firstly, due to that still mainly younger people are infected and they're at a lower risk of severe disease anyway. But the second factor is probably the strongest one now. There's strong protection for severe disease because you've had an infection before and or you've been vaccinated.
Kluter warns, however, that there is no evidence that Omicron causes less severe disease if a person is unvaccinated and never had COVID-19 before. Predicting when COVID-19 will no longer have a major impact on daily life, such as mandatory mask wearing, is still difficult at this stage.
Like with every pandemic, there is a new version of a virus. It has not had sufficient immunity. It builds it up. It changes its character. It's now in a fourth wave. Eventually, it changes so much that eventually it becomes endemic. That means it becomes just like any other flu virus that causes flu symptoms for which we have annual vaccines for. COVID is on its way to that. Whether that will be in a year's time, in 2 years' time, we don't know, but it is on its way to becoming endemic. And once it's endemic, it will be done in exactly the way like we've always dealt with the annual flu.
The Western Cape remains in the fourth wave of the pandemic, but early estimates are that the peak might be reached within the next 2 weeks. Mariska Botha, SABC News, Cape Town.